Dental problems can indeed be multifaceted, often requiring intricate and often complicated solutions to address the underlying issues effectively. While complex treatments may be warranted in certain cases, it's crucial to carefully weigh the associated risks and potential consequences. If a treatment fails, it can lead to further complications requiring additional, even more complex interventions and possibly impacting overall oral health and well-being. Moreover, it's essential to view dental problems within the broader context of the individual's health and lifestyle. That is the fundamental approach to whole health dentistry. The mouth is intricately connected to the rest of the body, and factors such as diet, stress levels, clenching and grinding, genetics, and overall health all can influence dental treatment outcomes. Therefore, a holistic approach that considers the patient as a whole rather than just focusing on the isolated dental issues is paramount. In many instances, simpler solutions may offer comparable and even superior outcomes with fewer risks. Less invasive treatments not only minimize the potential for complications, but also promote faster recovery and better long-term oral health. The majority of teeth I extract are teeth that have had multiple dental treatments. Each time a tooth is retreated, I feel the risk gets higher and the prognosis gets weaker. By prioritizing conservative approaches whenever possible, dental professionals can help patients achieve optimal outcomes while minimizing unnecessary risks and interventions. In fact, here's an article in the October 1995 Journal of the American Dental Association entitled, "Does the Cycle of Re-Restoration Lead to Larger Restorations?" And the conclusion is that re-restoration involves additional operative insult to the tooth and the potential for ever-enlarging restoration size. One may confidently hypothesize that the risk to the health of the tooth and the cost of restoring it increases as the cycle progresses. Formulating the most appropriate treatment plan for a patient requires careful consideration and thinking time. It's comparable to putting together the many pieces of a complicated puzzle. This requires time away from the dental chair. I find this cannot be a quick, on-the-spot answer. Today's medical and dental practices barely have enough time when the patient is there, let alone thinking time when they are not there. But this is the commitment whole health dentists are committed to. If adequate time is allocated, you can feel that the solution presented is in your best interest. So let's delve into an actual patient's journey through extensive dental work, from crowns to bridges and root canals. She faced a pivotal moment when her dentist at the time recommended 3 crowns and a 3-tooth bridge for her upper front 6 teeth. She reported that he claimed it was an urgency and had to be done that day. Despite hesitation, she agreed. However, the resulting crowns only allowed her front 6 teeth to meet, severely impacting her ability to chew. The strain led to a bridge breaking off at the gum line, causing infection in those teeth. She was made a removable partial denture to give her her smile back and until a definitive solution could be found. Now let's explore the critical thinking required to devise a solution that not only addresses the problem at hand, but also minimizes the risk of potential complications in the future. The patient mentioned that the dentist recommended restoring all the back teeth, including the current crowns and bridges, to rebuild the bite. However, it's important to consider the potential consequences of such extensive treatment. For instance, take the upper right 4-tooth bridge, which relies on a wisdom tooth and a bicuspid with a root canal and very large post, and both with compromised roots as anchors. Removing the bridge and preparing these fragile teeth for a new one could further weaken them, potentially leading to tooth loss. Considering the limited bone for dental implants due to a low maxillary sinus floor, replacing those lost teeth would pose significant challenges. Similarly, the upper left 3-tooth bridge faces similar issues, with the compromised anchor tooth being a bicuspid with a root canal and very short roots. The process of changing lower crowns, which have healthy pulps now, could also jeopardize the pulp health of those teeth. And there is a lower molar with a root canal showing signs of potential infection. Currently not a problem, but certainly an observation that needs careful monitoring. It's essential to weigh the potential risks against the benefits of extensive treatment, considering the patient's overall oral health and long-term well-being. Taking a conservative approach that preserves as much natural tooth structure as possible while addressing the immediate concerns may offer a more favorable outcome in the long run. Let's explore the innovative solution that was devised. Direct bonded composite restorations offer a conservative approach to restoring teeth, preserving and safeguarding healthy tooth structure. However, it's crucial to allocate uninterrupted time for the procedure, meticulously attending to every detail to achieve an outstanding, durable result. Effective isolation of the teeth from saliva and blood is imperative to prevent compromising the bond. While composite restorations are commonly used for natural teeth, they are typically not considered often for bonding to porcelain crowns. Bonding to porcelain requires additional steps and is even more technique sensitive, but the results can be exceptional. This is an article written by Dr. James Baker in the Dental Update, which is a British dental journal, entitled, "What is the Limit for Composite Restorations?" And his conclusion is, as controversial as it may sound, perhaps with its ability to be ultra-conservative and aesthetic, the only limit of this dental restorative material could be our ability as clinicians to use it to its full potential. In this case, composite overlays were crafted to fit over both the crowns and natural teeth, designed to optimize the patient's bite. This approach avoided invasive procedures and retained the existing crowns and bridges. The overlays were meticulously fabricated on a model of the patient's mouth and then bonded in place during a single appointment. The patient's long-term success with her existing crowns and bridges on her back teeth, despite weak anchor teeth, suggested that she was not a heavy bruxer or grinder or clencher, contributing to the favorable prognosis of the procedure. Overall, this conservative, non-invasive process left the patient delighted with her improved bite and minimal intervention required. So, what are the key takeaways from this scenario? Well, number one, extensive dentistry should never be hastily planned and executed. In fact, I believe no dentistry should be decided on the spot. If it is, don't feel pressured into treatment. Insist on a thorough conversation, ask questions, and trust your instincts. If you're not comfortable, don't hesitate to get up and walk away. Number two, when extensive procedures are necessary, it's crucial to have an honest conversation about the associated risks and long-term prognosis. Understanding the potential risks and poor prognosis, if applicable, requires forward thinking and careful consideration. Number three, complex dental issues, like any other problems, demand time and reflection for contemplation. When all relevant information is laid out, including photos, x-rays, clinical data, history, etc., and thoroughly analyzed, creative solutions often emerge. As a dentist, crafting a treatment plan, rather than simply generating an invoice from a computer, provides clarity and ensures a comprehensive approach. This embodies the essence of whole health dentistry. For more information about this and a variety of other topics involving holistic whole health dentistry, visit www.holisticdentallearning.com.